Now, one of the bacterial sexually transmitted infection or venereal diseases is chlamydiasis. It is caused by a bacteria that is referred to as Chlamydia trachomatis. Now, one of the most important signs and symptoms of chlamydiasis is production of excessive yellow colored mucus and pus. So it is called mucopurulent. That is because there is a lot of production of yellow colored mucus and pus. Now, why there is production of yellow colored mucus and pus? That is because there is infection and inflammation of the urethra. In case of male, infection and inflammation of epididymis, which is called epididymitis. Now, because the epididymis is infected, there is also unilateral scrotal pain that is seen in this particular condition. In females, there is infection of the cervix and inflammation of fallopian tube. Now, because there is inflammation or swelling in the fallopian tube, sometimes the embryo will not pass through if there is fertilization and formation of zygote. Sometimes the embryo may get implanted in the fallopian tube itself. This is called ectopic pregnancy. So due to the inflammation of the fallopian tube, there are greater chances of ectopic pregnancy. It may also cause a swelling and inflammation of the rectum, which is the terminal part of your digestive system. Thus, before the anal canal, it is referred to as proctitis. Generally, the incubation period is 1 week. Diagnosis involves gram staining, detection of antigen in the body of a suspected patient, and treatment is again by treating them with certain antibiotics such as tetracycline and erythromycin. Chancroid is another bacterial disease, and this chancroid is caused by a bacteria that is called Haemophilus ducreyi. Now, unlike the chancre, you had come across a word called chancre encephalitis, which was very clean and which had a hard base. It was painless, but a chancroid is an ulcer that has a necrotic base. Necrotic means leading to rapid death of tissue at the base of this eruption seen on the skin. So the ulcers have a necrotic base. They are very, very soft. They bleed very easily. Such bleeding ulcers are a common feature or a common symptom in the case of chancroid caused by Haemophilus ducreyi. And where are such bleeding ulcers formed? They develop mostly on the external genitalia. They also lead to the swelling of the local lymph glands. Again, gram staining. Whenever it is a bacterial disease, gram staining is the best detection method. Most of these pathogenic forms are gram negative forms. And then, of course, since a bacterial disease, again use of antibiotics such as erythromycin and ciprofloxacin. Then we have protozoan diseases. Protozoa are unicellular forms which belong to kingdom Protista. So under protozoan diseases, we have Trichomoniasis. The causative agent is Trichomonas Vaginalis. Now this Trichomonas Vaginalis, this infection is also known to produce a lot of yellow colored discharge. A foul smelling yellow colored discharge is a characteristic feature. It causes infection of the vaginal canal, that is called vaginitis, infection of the urethra and leading to burning sensation during urination in case of females. In males also it can cause infection of the urethra, infection of the epididymis, infection of the prostate gland. Just like we saw in females, there is pain and burning sensation during urination. So diagnosis includes microscopic examination, collecting the sample, the discharges, and observing them under the microscope. You can actually visualize the protozoan under the microscope, and also detection of antibodies in the body fluid of the person who is suspected to be suffering from the disease, and certain drugs which are used to control the proliferation of this protozoan parasite is metronidazole. So metronidazole is a drug used in treatment of trichomoniasis.